Hey everybody, it's Nick Kman coming back at you with another Columbus Medical Association update on COVID-19. The last one of these that we did, we talked about return to school. I wanted to do one that talked about fall and what we have to look forward to, what we have to anticipate, um, and how we can make Halloween and Thanksgiving and things like that safe. So, what we talked about last time I was with you, we talked a lot about how community activity was going to impact how our kids go back to school. So, we talked about if there's a lot of cases in the community, those cases are going to trickle into the schools. They're going to trickle into your sporting events. They're going to trickle into the workplace. And I think we've certainly seen that, unfortunately. We also talked about the core tenets of COVID, the fact that we need hand hygiene, universal masking, symptom monitoring, cleaning and disinfection, and physical distancing. So, I work in the emergency department at OSU and have a shift here in a little over an hour. We are seeing more activity. So this is the activity across Ohio as of the 20th. When I started putting this slide deck together, these numbers are already a little bit higher. The trend is what's concerning. I think you could see that yellow arrow that I put on the slide. It really shows that unfortunately the cases are going up. And across the state in Franklin County, Cuyahoga County, our high populous counties were getting near, level 4 levels, and the trend is what's concerning. Um, Obviously, there's a lot on social media about the cases and deaths and the election and everything else. The deaths, thankfully, the trend has been fairly low. And I think the reason for that is a couple things. First of all, in medicine, I think we're getting better at this. I think we're recognizing cases earlier. Just this past week, we got FDA approval for remdesivir, which we know can shorten the course of COVID. We know dexamethasone can help with outcomes. A lot was publicized with the care the president got. We don't have monoclonal antibodies yet to give patients. That was an experimental treatment, but our treatments have gotten better, and that's a good thing. But hospitalizations are up because people do still get very sick. And if you look at the news out of El Paso and Montana and other places where they're seeing huge spikes, the hospitals are just very full right now. So this was the activity last week, and it's already, the map has already got more red on it today than it had then. So, we're not doing a great job. We're good at a lot of things in Ohio, football and family and all that, but coronavirus has not been great. Although we've been better than a lot of other states, I will say. These are the confirmed COVID patients in Ohio hospitals by day, and you can see what the trend looks like. And our hospital is one that's pretty full, and I think a lot of the hospitals in the region are getting pretty full. And what you need to keep in mind is it's not just about COVID. There's other people in the hospital right now. We're starting into flu season. We're starting into pneumonia season. The respiratory viruses are starting to circulate, and that's what we're going to see. But it's not all doom and gloom. So I hear a lot of people say, I can't live my life, and this needs to be over and things like that. It's going to be. Like I said, we're getting better treatments. Vaccine is on the horizon. I know Ohio released its vaccine plan last week. I was listening to the webinar on how it's going to be released. I think healthcare providers can expect to probably get a vaccine this calendar year, we would hope. But some of the things that we've been doing, I have a short throw HD projector. So we have a fire table and we light the fire and we sit out and we watch movies. We watched Goosebumps, we pick Halloween movies, Ghostbusters and things like that. We went to Topgolf a couple of weeks ago. Is the first time we had gone there, and that felt like a really, and I have no vested interest. I'm not a, I don't get paid by Top Golf, although I'm always open to a free session if they're interested. But it felt really safe. Like, we had booked a time. We got in there. We went right out to our little outdoor bay. There's plexiglass dividers. I don't know how much those do, but I think being outdoors with good ventilation is pretty safe. I have family that have gone to some of the sporting events that there's fans at, and what we haven't gone yet, but what they've told me is, you kind of stay in your pod, your 4 ticket pod, and you're away from other people. And if it's outdoors, again, that should be very safe. So, hopefully people are getting out and trying to be, live their lives. How about voting? So, there's a lot about voting. How do you do that safely? Really, the same core tenets hold true. You need to wear your mask. You need to stand 6 feet apart. I would recommend staying outside as long as you can. So, we've all seen the lines that are outside that kind of wrap around. Much better to have the line outside wrapping around than inside snaking around. If you can go at off-peak hours to avoid standing inside for a long time, I think that's important. And then a lot of hand sanitizer. So, I have a little, I should have grabbed it. Actually, it looks just like this. It's the same type of spray bottle as this. And it's just a liquid one, and I keep it in my pocket and just make sure I keep my hands clean. Most places should have hand sanitizer out, you would hope. Family gatherings are really tough. Like, my wife and I are kind of agonizing over what to do for Thanksgiving. And, so I'm sure you are too. I mean, here's the problem. Contrast the 4th of July with Thanksgiving. What's the 4th of July look like at your house? At my house, it's a cookout. Everybody's outside. The kids might be, water balloon fights, whatever. What's Thanksgiving look like at your house? Everything's shut. Everybody's inside. Everybody's packed on the couch watching football, eating food. Families are mixing in and out. This is going to be tough. It's going to be tough. I work Thanksgiving Day, so I think we've already kind of committed to, we're probably not going to get up there for Thanksgiving. If you could somehow do it outdoors, it's going to be safer. Humid air is actually safer. And I'll show a little paper about that. But the other problem is this. The community spread is going to impact these family gatherings. So I mentioned the 4th of July. Our rates in the beginning of July were very low of COVID, or much lower. So you were less likely to have somebody at your cookout that was COVID positive in July than you are in November. In November, COVID's everywhere. So the chances of niece or nephew or cousin or Uncle Bill or whatever coming in, who doesn't have symptoms yet, unfortunately, that's a possibility and actually a probability. So ventilation matters. I showed this slide when I was talking about the schools, and on the right of the slide is the restaurant in Wuhan, China, where everyone got infected, and they actually contact traced this out. It was a very small restaurant, very poor ventilation. The first case was A1, and as you can see, just about every other person in that restaurant got infected. And there's a picture of the Rose Garden on this slide, and there was a lot of talk about the 35 people that got infected at the White House. I would suspect, and I've seen a little bit of this in the press, that it had more to do with people going in and out of the West Wing than it did the actual Rose Garden event, although people were really not spaced out. But I still think outdoors is going to be much safer, but you got to think about ventilation. I mean, let's be honest, the White House is a very old building. Ventilation's probably pretty poor, and that's why they struggled with what they did. Here's what I was talking about with temperature, heat, humidity. All that stuff actually kind of matters. Now, so we had thought hopefully the virus will die down in the summer, and it did. The problem is we didn't tamp it down enough for it to go away. So it just blazed right back like a forest fire. But But studies do show that more infections happen when a relative humidity is between, um, you know, 40 to 60%. So in the summer, things are very humid. Your airway, your respiratory system is nice and moist, and when it gets cold, the humidity drops to like 20%. And there's research from a lot of different, studies, both with MERS and other respiratory viruses, that the low humidity, in your house, the cold, dry air, we see a lot of nosebleeds in the winter. That's going to have an impact. The virus stays stable and longer on our bodies when the humidity is low. So, it's more bad news, I guess. So what about Halloween? Is it safe to trick or treat? Can we let our kids trick or treat? Of course we can. It's outside. It should be safe. But we have to remember the things that keep the virus from going from one person to another. And those things are space, masks, good hygiene. I think kids need to wear a mask, and it shouldn't be a mask over their mask because, that's not necessarily safe. It should be a mask, hopefully incorporated into the outfit. So that's my little guy, Ryan. We went to a trunk or treat car show, and he is going to be Minecraft this year. Video game I do not understand or get anything about. But he has a Minecraft mask, and he's going to roll with that. You got to avoid the Halloween parties, especially inside. So, bring hand sanitizer. I think our plan is to have a table out with, individual like bags of candy, and the kids can just grab one. Make it all the same so they're not all picking and, I got to get the Reese cups and all this and that. So make it so they can grab one and be spaced out and get along to the next house. We didn't go to the pumpkin patch this year. Our kids are a little bit older, so we've kind of stopped doing that. But the orchard, the pumpkin patch, the corn maze, that stuff should be pretty safe as long as you're outdoors and you're hand sanitizing and you have a mask. As far as things to do on Thanksgiving, this is tough. If the weather could be nice and you could be outside or on a well-ventilated, all the windows up outdoor patio room, spaced out, less than 10 people if possible, not a lot of family mixing, that should be pretty safe. Can you get together virtually? We've gotten really good at Zoom and Teams and other platforms. Do you got a big screen at your house that you can throw up Zoom for family and everybody's looking at each other? It's not the same, I get it, but something you could try. Things that you shouldn't do. Obviously, I work at Ohio State, and there was a lot of, unfortunately, national media coverage of the keg parties and the bashes that were happening during the OSU game. And the first thing I said to my wife and some of my partners is, I can't believe they're going to have a night game on Halloween night. Just poor planning. I mean, I think, kids are going to party, but the problem is this, that age demographic, high school and college kids, are by and large very healthy. So, they get the virus, it gets spread around, and they do fine. They get congestion or the sniffles or whatever, but then they go home to mom and dad, and dad has diabetes, or someone's overweight, or grandpa live in the house, and that's where the problems happen. So please try to be safe on Halloween night for the tailgates. Try to space out. Try to have smaller groups. The Black Friday sales. I don't go in stores. Amazon is my go-to. But for those of you that it's a tradition to go to Walmart at midnight on Thanksgiving, I'd think about that. As long as you have your mask and your hand sanitizer, it's probably going to be okay. But if it's a mess of humanity and there's a ton of people there, it's not going to be great because you're indoors. Um, let's talk a little bit about travel. So, there are a lot of people that are going to be getting on a plane um, and traveling. So, um, you got to think about that. So when we deployed to Hurricane Laura with our disaster team, our original plan to get back from Lake Charles was to go through a state that had like a 29% positivity rate. And we actually changed our whole travel plan to avoid that state because we were afraid, if my employer finds out I was in Mississippi or wherever, there's a high rate, are they going to quarantine me upon my return? So you got to think about where you're traveling and whether it's worth traveling there. So I had a friend who asked me about air travel. So is it safe? And that's complicated. There is good literature that shows COVID spread on airplanes. Two studies, MMWR, the one on the screen with the picture, the figure of the airplane. The index case is 5K, which is up there in business class, and you can see that just about every person around that person got COVID. And you might say, well, what if they were sitting together in the waiting room waiting to get on the plane, or they were together on the at the baggage claim or whatever? They actually studied the genetic sequence of this particular virus, the virus itself, and were able to determine it was the same exact genetic code. That's how good they've gotten at tracing where the virus is. One of the concerning things I think about this picture is all the purple on the screen are people who they didn't follow up with. So they got on a connection and went somewhere else. And so, they had 20% of the plane get infected and 20% of the plane was lost to follow up. So how many infections would that be? Yeah, so here's the thing. So those studies where a lot of people got infected on airplanes were mostly in March and February when people weren't wearing masks on airplanes. So that's the important thing to know. Now here's another one to look at, and this is a aerosol dispersion report done by Boeing and United. So, the first thing you got to do is you got to question the source. Now, Boeing and United have certainly have a conflict in that they want people on airplanes flying. But the good news was the models they used, they blew simulated virus particles through the air inductions and all the ventilation of the airplane, and there was an extremely unlikely exposure for a long flight too. This would be a 12-hour flight. So that was good news, and actually JAMA, kind of trumpeted that as well. Here's the bad news. The study made some assumptions that there wouldn't be a lot of sick people on the airplane. People wouldn't be coughing, sneezing, talking loudly, which would project more virus. They assumed that mask use would be continuous and that the number of infected personnel is low. So if you can assume all those things, and you know that the person next to you isn't nose mask guy with the with his N95 on his head or on his chin. If you can assume those things, then it probably is safe to fly. I mean, I think if you can drive someplace and be with your family, it's going to be safer than that. But I do think air flight has gotten much safer with mask use and with ventilation, and this study does prove that to be true. So JAMA came out with a patient page on this, and again, one of the things that they say is the ventilation's really good. It comes from the top of the airplane, you can see on that picture, and then goes out through the bottom. But again, there's a lot of assumptions in these studies. How many bags are under your seat? Can the air really get through the ventilation system? Are people wearing their masks consistently? So things that you have to think about. So, I talked about masks. So the literature is clear. When people wear masks on airplanes, after March, people don't get sick. When they don't wear masks early in the pandemic, people get sick. Here's another study that shows the importance of masks. And, I know, probably people are clicking off but this is really, I think, interesting. So this study looked at 13 states that opened after having a mask mandate in place. So this was, when we were opening up at the end of May, these states had mask mandates in place. And, a lot of these were very famous. Michigan, a lot of press over what, you know, people thought of how the governor handled things. New York City. I mean, these are states that were impacted by coronavirus. And here's what they saw. And this is very hard to refute this data. The states that opened with masks, you could see their rates on the right of your screen. So the change in cumulative cases in states that didn't have a mask mandate, and we all know where some of those are, and actually Ohio didn't. We had one very soon after and did very well, I think, but we weren't in the 13 states with the mask mandate. But you could just see, by week 8, 643 cases versus 62 per 100,000. I mean, that's tenfold different. So it matters. You got to put it on. It matters. And then the last thing I wanted to talk about was the flu vaccine. So a lot of people have thoughts about the flu vaccine. Don't get the flu vaccine, this or that. But I will tell you this, the flu vaccine is usually very good. There's literature that shows that if you get the flu vaccine every year, you're much less likely to have a severe influenza infection. They actually looked at nursing home residents that had the influenza vaccine 3 years or more consecutively, were much less likely to die of influenza. It's important to get it. Here's the other reason. If I could just appeal to this. You get the flu, you get a fever. You get a fever, you can't go to work. You can't go to work, and your employer says you can't come back until you get a test. You get a test, it takes 48 hours to come back. At the very least, it's going to impact your life. It's going to impact mine because a bunch of people are going to come to the ER with a fever, and we got to figure out whether it's COVID or influenza. But I would appeal to you this year for any other reason than to take that variable out of the equation. And then when you get sick, if you got the flu shot, we're going to be looking a lot more COVID than we are influenza. So that was what I wanted to talk about today. I think Halloween we can do pretty safely. Again, we have a projector. I think we're going to probably throw the game up outside and watch a little bit of the game, but be spaced out, be outdoors. And we'll see what happens by the time Thanksgiving comes. But that's a much tougher, I think, decision. So anyway, thanks to Columbus Medical Association for letting me talk about a few things that are going on with COVID. And again, I'm Kman from Ohio State Emergency Medicine and Ohio Task Force 1, and everyone be safe.